right, ladies and gentlemen, please let's resume our seat. All right. We have, we'll continue with our provinces reporting. This afternoon we continue with that, all the provinces reporting. Some provinces are not here. Central province are being excused because they received the notice late and they have not prepared their submission or presentation. This afternoon too, we have the civil society will be completing our hearing for this session starting from yesterday to today. So before us, I believe we have the Deputy PA from Morobe, and we also have a Deputy PA from Isipik, and we have a Deputy PA from Enga Province. So gentlemen, thank you for making time available to support the committee in our very critical work to address gender-based violence and, more importantly, work towards gender equality. Some provinces have made a presentation in the morning, so you might have been privy to it, listening to the presentation. So we will go through the same process, basically to update us if your respective provinces have adopted strategies to respond to and end gender-based violence, and whether that strategy has been endorsed by the provincial PC, Provincial Executive Council, and your provincial assembly in your budget session this year or maybe last year or previous years have made allocation, so we can see how you are faring in terms of responding to this pandemic that is affecting the entire country, but more particularly women and girls of our country. So thank you. Without further ado, I think we'll start again from our left to right. So on the left, yeah, we have a provincial administrator here. Oh, provincial administrator from Morobe is here. Thank you. My apologies on behalf of the committee for not recognizing you. So we'll start with the provincial administrator from Morobe. Deputy, So gentlemen, please introduce yourself. We only have the names of your PAs.
Thank you. My name is Robin Batino, Provincial Administrator in charge of social services. And thank you once again for the committee to call us to come and present to us the status of our province. I have a long list of presentation, however, I'll go to the snapshot of what has been occurred. In Morobe province, we have been implementing the strategic plan. However, we have faced, within the years of the government decision on gender-based violence, we have faced quite a number of challenges. Firstly, the Morobe provincial performance since 2023 to date. Specific GBV strategy is still in the national, is with the National GBV Secretariat. The cash flow activities has been finalized. However, the Secretariat wants the standardized formalities, including uniform design. Hence, we are still waiting for them to complete it and forward it to us. But in our wisdom, most of the GBV activities were captured in Morobe Provincial 5-year strategic plan, in line with the MTDP4. Therefore, we are now implementing in our AAPs. But PC endorsement is still pending until GBV Secretariat formalize and release Morobe Provincial GBV strategic plan to us. This is the reviewed one. status of GEWE. Specific GEWE strategic plan is something Morobe province is yet to develop. However, GEWE activities are captured in the overall provincial integral human development policy number 5. Activities in the 5-year strategic plan as the GEWE, as does the GEWE. Therefore, our division of community development develops AAP and implements that activities annually. But I will definitely work on this and make it a standalone program activities. Financial projection per annum. Now, in financial projection 2023 to 25, it is a administrative recurrent program from our administration grant, and it has been allocated a 320,000, so we divided into the general activities, which captures the gender-based violence as well. And our community development division implements that. The one thing that we Morobe province have is we have a strong partnership and networking that is in Morobe. We have a strong partnership with APLJ, which was formerly JSS4D, the Australian, the UNDP. Now the US is coming on board. We have Engau Family Support Center, which is the only in the country. Family PNG, City Mission, other NGOs, CSOs and FPO, the district courts. Yeah. And the summary, I'll just give brief summary, statistic summary of what we have been doing. We have 4 safe houses in Morobe province, especially in Leh, but one in Wow, that's Wow area, but it caters for only children, and we haven't really gone into that as yet because due to our financial constraints. And our safe houses can hold up to 30. We have about 19 police stations, 10 in metro and 9 in the province, and we have made our business to make sure that we have FSVU units in all these police stations. We have about 18 police personnel are trained FSVU, and it is about 75% operational and successful. We have 2 hospitals that are Engau and Brown, but in Engau we have this family support unit. Support center. We have seven of them working there in Leh Family Support Center. 2 are social workers and 5 are nursing officers. We have about 30 are GBB service providers, while the other 15 are from Morobe Advanced Care Center. We have trained about 100 village court officials, synthesized them into GBV. However, I cannot provide a statistics of how many cases that has been handled. But before I came, Lay District Court senior magistrate gave me a statistics of last year's 2024. We had about we had about we had about 390 cases, but breaking into breach of IPOs were 5, domestic violence assault 57, domestic violence threatening behavior 11, and domestic violence threatening behavior and threatening were 30, and domestic assault threatening were 50, domestic assault 1, rape 21, sexual penetration 36, sexual penetration to child abuse is 15, sexual relation 1, persistent sexual abuse 2, sexual touching without consent 1, and 4 and protection orders issued were 180. In summary of, and it's a consolidated GBV dashboard outcome come for GBV cases. This is committal 21%, POs issued were 46%, and 33% were summary. It's presented in the court. And this is a basic summary. Okay. The success summary is that GBV in bracket SVU is up and running because of the support that comes from within the police command, from stakeholders, partners, even individuals see that there's a need that they need to come and give us support, civil society and business houses and lay. Another thing that we have our strength is effective collaboration and network, and then successful decentralization in districts where transport accessibility is possible. So one of the interventions that we are taking now is Morobe provincial government is recruiting and training reservists, and that's where we want to come in and try to synthesize them in the work of GBV or GBV space. The other preventive measures that we are taking is we are trying to strengthen and synthesize the village court magistrate, how best they can mediate and take it up to the district courts, refer to the district courts, where we have to synthesize the district courts magistrates. Now the SPM is the only district court magistrate who is well synthesized with this activity. Impediments or challenges in the course of executing GBV in Morobe province. 1, Morobe provincial budget per fiscal year does not capture GBV program in Morobe province. Secondly, is provincial structure that does not capture GBV position. However, as you have reiterated, Chair, but the structure is the call of the provincial administration. As we justify why we should have the structure, including the GBV. However, Morobe provincial structure is very old, and we need to review, and we have already advertised and recruited officers. So after completing the recruitment, then we will go for restructure, and then definitely we will see the GBB structure captured in our overall provincial structure, administrative structure. Referral pathway in rural areas are too difficult for GBV victims to access. As I've said, we have decentralized to accessible districts. However, there are silent majority, our women folks and daughters are still suffering in a rural area where they cannot access referral pathway. And that is a challenge, and I believe it's a big challenge for the country. Limited trained police personnel in executing GB program. And another thing is we need trained family support nurses. They only know how to administer drugs and medicine, but especially in counseling is one of the difficult area. Not enough safe house and funding for their operations. Lack of awareness for people to know about their constitutional rights and to respect others who have the same constitutional right as them. Thus respect women and children. Immediate need for the province, need sufficient operational funds to physically visit decentralized sites to assess the success of GBV activity. Secondly, fully resourced staff of Engau Family Support Center as the only breeding ground for other health centers in the province and in the country to learn and establish on. Synthesized district and village court magistrate and police officers on GBV and behavioral change. Need an information database or data management system to help us monitor the improvement and in the province. So these are our biggest challenge, and our only recommendation from the province is that the provincial executive council, although according, and this comes to the psychology that we draft budget, and actually I present the budget. However, we don't argue in the budget, and our PC has not really captured grasp the importance of why we should fund GBV activity. Many times I've called, but it is not. So my recommendation is that your committee take it up to the level and summon our governors to see the importance that we, the officers, are trying to implement to save our people. Thank you very much.
Thank you, Deputy Administrator Morobe, for your presentation. I think there are a number of big challenges there that you all have to overcome. Important thing is to get a strategy in place, to formulate the strategy and get it endorsed by the PEC, and of course attract funding. Without the strategy being in place and having a coordination capacity, we will still continue to operate ad hoc. And that's what we've been doing in so many years. Before the national strategy was adopted and launched in 2016, 2017, a lot of work has been done in this space already with the family FSVSU committees. Mm-hmm. They've been working for maybe 20 years. Yeah. So that family sexual Sexual Violence Committee. They work for about 20 years, and since 2020, 2016 up to now, it's another 9, 10 years. So it's almost 30 years.
30 years.
The statistics has not changed. In fact, it's gone worse. So it means that we are not doing things right. We are not serious. We are not recognizing the gravity of the problem at the end. And when we do that, it shows that we are not appreciating or recognizing or respecting 50% of our population, women and girls. They are the most people, sector of our community, of our country, who are victimized by gender-based violence. So, em knows Jimmy Gada, you blow province too. You know, look sabe long all, you know, the value of women and girls, respecting 50% of our population. So it does not just affect their rights; it affects the entire development process too. Because you must look long and also from another perspective. Women, they, you know, give life to all of us. And if they are not in a good, conducive environment, not respected, then it affects early childhood and it affects life of everyone, men, women, and children. So our journey is cut in the beginning if at the early time, our mothers, for example, are subject to violence. So this is why it's also a development issue. It's not only just a human rights issue, it's a development issue. So I think the call now is for us to multiply our effort. So I hear your recommendation on behalf of the committee. I want to thank you. If we have to, and I think the next step for us is to summon your governor to come before us. Between now and then, perhaps you all, with our development partners, can have an engagement with him. Make an appointment with him, get him to understand and recognize, and we'll give him the statistics. So we can understand it too, not just him, but the PEC. Yeah. And once we show leadership at that level, then everything works, you know, down the line. But right now, it seems like your political level or the PEC is an impediment to getting Morobe across. So I just want to conclude by saying that Morobe is a big province in our country, both in land size and in population. It's similar size to Eastern Islands, big land mass, big population. The two CPIC regions are maybe among the biggest in terms of both land size and population. Western Province is the biggest land size, but small in population. So Morobe, Eastern Islands, and East CPIC, West CPIC, they are the biggest part of our country. And if you all get it right, then the country get it right. But if you all don't get it right, then we can't get it right. So we need, you know, to have this outcome achieved in those provinces of ours that can lead the way and make an impact. So thank you, Deputy Provincial Administrator. We will move to, unless our two embassy, you have some comments, or we'll go to ICPIC. So Deputy Administrator ICPIC, please, you have the floor. Make your presentation. Thank you.
Thank you, Chairman, Honorable Pakop, and your esteemed committee members. Thank you on behalf of ACPIC. I'd like to greet you. Thank you for giving this opportunity to present the ACPIC case. I don't have a PowerPoint presentation, but I'll do a verbal presentation to the committee. Firstly, before I start, apology from PA is we have a law and order situation in Aitape. So the PPC and the PA has decided to go over there, and I had to get on the plane with my officer, the executive manager for community development. So apology once again. We really would like to be present yesterday, but unfortunately we were not able to make it to attend those very vital sessions you had yesterday, so we missed out on that. But thank you so much. I have my executive manager, community development, division for community development with me. Thank you.
Deputy Administrator, please state your name for the record, so it's recorded.
Thank you, Chairman, through you. My name's Alphonse Kami. I am the Deputy Provincial Administrator for Social Services Sector, ECP Provincial Administration. And that's where Division for Community Development comes under my sector. I have the hard copy of the report I just presented to you. And sorry, members, I just presented only one copy. But I will do the verbal presentation. Everything's in the report. The report presents to you what we have done. It is in two parts. One is reporting on the GBV, and secondly, towards the end, is the work on the gender equality and women empowerment we're doing in the province. In answer to the questions that we were informed to come in preparation to attend this hearing, the ECP provincial government is really supportive to the administration to implement the GBV in ECP province. With the deputy chairman and my governor for the province, Honorable Hallenberg, has been very supportive and also is an advocate of this. Under his leadership, the province has supported, and we have the strategy done. It has been approved by the PEC with funding allocation annually, 500,000 to implement the GBV in ECP province. Under the provincial government, under his leadership, we have funding allocations appropriated to other areas like sports, youth, and so on to complement as well as to support GBV, because as we have stated earlier on, and I concur with the earlier speakers, it is cross-cutting. So we have adequate funding there, but we need extra. I will speak to you, highlighting why we need extra as we go on. Our work on GBV started way back in 2021, and like the others have said, we never had the officer particularly or specifically responsible for GBV. So the onus was on the community development division, and the executive manager was given the mandate by the provincial administrator to take charge and deliver GBV. On the GBV programs are currently implemented in the province, even though there is no permanent officer, but under the executive manager who has been given the tasks. Formation of the Provincial GBV Action Committee, we have a committee in place. It's made up of all the stakeholders and our statutory bodies, those who are really working closely, interacting with the other stakeholders in terms of GBV, where the membership includes NGOs, CBOs, CSOs, FBOs, and other government agencies. And the Deputy Provincial Administrator, Social Services, which in this case is ECPIC. I'm the chairman, and we meet quarterly, and there are events, circumstances arise, then I can call for urgent meetings or inaugural meetings. So that's how we're operating. The response, in terms of response, 2023 to 26, we have a wider consultation and collaboration with multi-sector and interagency partners. Would like to thank UNDP, the Department for Community Development and Religion, European Union funded Spotlight initiative through that initiative, and it in the Provincial Executive Council meeting in 2023, an annual funding of 500,000 Guinea was approved for GBV in ECPIC province. Initially in 2022, I think it was 200,000. And then in 2023, when it was approved, we're operating on that. The 4 outcomes, we're okay with outcome number 1, number 3, and number 4. Outcome number 2, which is on database, that is our need. We are desperate for a database, management information system rather. We just started mobilizing. We brought in machine or some computer and all this, but we have yet to establish the system there. The other approach that we've taken, we have as a province, the programs that we are trying to implement in the districts and in the province and districts and LGs as a whole, we are also conscious and we are mindful. And the question we're asking is, there's a lot of law and order issues, family problems, and many more. So GBV and the society it's insecure now. How do we live peacefully? So that's the type of question we're asking. So in order for a program to reach out, do outreach work and all that, extension work, we are beginning to move as a team because we believe that GBV can be addressed by all rather than just one individual program like community development. So in the sector, we're taking the lead where all the programs under the social sector like the community development, education, health, law and justice, disaster, environment, and climate change. We're all moving as a team and we are supporting one another, complementing because we believe that it is a cross-cutting issue now. So that is the type of approach we're taking. An example would be about 3 weeks ago, we moved as a team. We partnered with our district guys from Wasaragawi district, and we attended a reconciliation ceremony where two groups of people had to reconcile and in all Brukim Spear. All Brukim Spear, Live, Longogra, all representatives, UN government officers, stakeholders. We had Bishop with us. And that was the day we saw God. And I think everybody felt God was there because as soon as the pigs were exchanged with the yams, there was thunder and lightning, and everybody shouted that that's God is with us. So, yeah, there's a lot that we will have to do. So we have those challenges, so we are looking at moving as a team to address this situation. I'd also would like to comment in terms of prevention and interventions from the GBV strategy. those who are supporting us, the Pacific Provincial Health Authority, they've been very supportive. They're playing their roles, the Royal Papua New Guinea Constabulary, the Provincial Public Solicitor's Office, village courts, both the village courts and the district courts, PNG Correctional Services, ACP Council of Women, where it is affiliated to the National Council of Women, and we are fortunate to have 6 district council of women. They all affiliated to the East Pacific Provincial Council of Women. And we intend to reach down to the LLGs, our 28 LLGs. We've got crisis centers like the Nanakundi Crisis Center, St. Anna Crisis Center, Family for Change. That is another community-based organization based at a Creek compound in Wewak. And then we have the Catholic Diocese of Wewak through the Carita PNG office based in East Pacific Province. They conduct GBV prevention programs and so on. We have the Civic Center of Hope, where it is also run by the Catholic Church of East Pacific Province. That's where we have HIV testing and HIV ARV drugs offered. They offer counseling and post-exposure for rape victims and so on. Welcome and Belisi Center, and we have the Kalang Services, that's for inclusive education resource. And also in our structure, we've also, we wanted to be inclusive, so we have created positions and we'll be advertising shortly for the disabilities, and also in education institution program, we've got an officer who's the inclusive officer, provincial inclusive education officer, where one of the requirements is inclusivity. So I think I'll try and make myself short there. In terms of gender equality and empowerment, yes, we're doing a number of things. We were privileged to have the Pacific Partnership. That's from the countries that came. The Pacific Partnership that was created as a result of the tsunami and the earthquake around the Indian Ocean area there, where a lot of people died, about 200,000 people, more than 200,000 people. I think it was in 2004. That's the Indian Ocean earthquake and tsunami. So that partnership was formed by countries like USA, Australia, New Zealand, Chile, North Korea, Britain. Did I miss out one? I think, yeah, about 8 of those countries they visited. And we were fortunate, Wewak was selected as the city in PNG that they would visit. So that partnership, we were able to interact with them. There were trainings done to allow women and other stakeholders. And through that training, women were able to see that that's vital in terms of economic activity, like that sort of, pave way for SME and all that. So, all Mary Lesibiki kirap nal tog I me plod Mary Blokim Bilum to ya. So, the idea developed, and we have a show. The idea of having a show, civic basket balloon show, it's earmarked for October 14th. I don't know, October 14th is what? Pinktober or the Salatog or Toger, Pinktober. Okay, that's the time that we would like to drive that with that, so that women folks come in and they present themselves. So we're doing all this to empower our women. So there are a lot of things, but we are so thankful that the governor is really pushing. So we are doing it so that able to meet what this committee is really earmarked to do and so forth. With that, I think, Chairman, through you, I will stop here. Thank you very much. God bless.
All right. Thank you, Deputy Administrator, Social Services in ECP for your presentation. On behalf of the committee, I want to thank you all for the work you are doing. The basics are beginning to take shape. If I could make some comments on behalf of the committee. Provincial government has recognized the gravity of the challenge you all have and has endorsed the strategy, allocated funding. I think now it comes to working out the better methods of implementation or coordination. So I just want to note on behalf of our committee, and of course our committee members can also give some opinion too, but just on my part, I want to commend you all for a lot of good work. As you have mentioned, it's a cross-cutting issue affecting so many sectors, and equally would involve a lot of other sectors, and that should be the case. But I want to suggest or recommend too that you all have a clear focus dedicated to GVB. So it can involve all the stakeholders. There can be overlapping collaborations and so on, but the coordination must be focused on GVB and of course on gender equality. Because sometimes if it's saturated, like it's dealt with as community development generally, then it gets saturated and the attention and focus in terms of both energy and effort and resources is diluted. So, of course, all sectors are important. You all have to address all the different sectors that you all involved in. But in terms of responding directly or in the case of gender-based violence, I think perhaps this something that Secretariat can share with you all to come up with a SOP in which the basic minimums must be put in place so that it will help us to focus, help us to really put the resources and attention in directly towards GVB so that we make a difference. Because the statistics that keep on coming are mainly from those that are reported. Just like earlier in the morning, West New Britain, for example, they concede that this is only perhaps in the urban and pre-urban areas like Kimbe, Hoskins, and maybe Biala. But the province of West New Britain is a big province, both landmass and sea, and they've got some island too. So they have not captured those. And although in the past the rural areas are relatively peaceful, doesn't mean that instance of gender-based violence is taking place. So I gave the example of the district of two districts in Southern Islands of Imbongu and Yalibu Pangia. It's relatively peaceful in the context of tribal fighting, but in the context of gender-based violence, it's still high rate, and that's why the Minister, Attorney General made a decision to set up the community center in Walume, and it's a great facility. I want to recommend that some of you all provinces can go to Walume and see what they've built up there. It tried to be inclusive, and it's got a safe house in it too. And as I said in the morning too, if we are trying to interact with the Department for Personal Management to get the capacity, especially into the districts, then if we follow the strategy, like it's a national plan, it's been approved by NEC, and if we just follow that plan, then DPM cannot stop us because it's a NEC decision. So if we build like community center, whatever we call it, but we can style it in the format of a community center,
Yeah.
come into the category, then we come to DPM. And why by stopping you? Because some policy block government, it's endorsed, fully endorsed, so they must set up the, approve the capacity, so you all in the provinces can create the position down into the district so that they can start to provide those essential services, especially around GVB. The coordination happens at the national level, at the provincial level, down to the district level. And towards that end too, I want to remind us again of a successful template that we have in the 80s to the now this century. And that is the capacity and the response we all did towards HIV and AIDS. We set up the system from the National AIDS Council and the Secretariat down to the Provincial Council and the Secretariat down to the district and to the ward. We work top down, bottom up, left to right, side to side, and we were able to reduce the prevalence of HIV and AIDS. Because in the 80s, the assumption was that we will go sub-Saharan way. It will blow out of proportion. But because of the response that we, and the structures and the system we put in place, we were able to contain that epidemic. Now it went below 1%, or it's gone below that percentage. At the time, I think in the 90s, we were going towards 3% or something like that. Now we have retained it below 1%, and we are becoming a bit complacent, so it might be coming back. So this comment, not just for Isipik, but Morobe and province of Enga too, we can take note of it, and all the other provinces. So thank you, Deputy Provincial Administrator. On behalf of the committee, I want to thank you all and commend you all and encourage you all. But again, remind you that we need to operate in a crisis. We need to operate in a crisis. Again, if I could just stress that before we adjourn for lunch, I was also giving the statistics for the provinces, and you can see like Manus province, our smaller province, relatively peaceful. People consider it's peaceful in terms of all the other forms of violence, but it's still got a high instance of gender-based violence. And perhaps as part of SOP 2, the GBB Secretariat can send to you all a standard type of questionnaire to get data. So we can elicit from both urban, pre-urban, and rural areas as to instead of gender-based violence. Because you may think of some low place, Kanaka, I think all knows have got this idea, but we even asked the women in the rural areas, in the family situation, when they are on their own and they will give the confidential information, it might be revealed that they have problems in marriage. Secondly, they might have problems in rural areas now, going to, let's say, gardening or going to have a bath in the river or at the beach. Or, in the past, we respect that. This place and place lo mama lo go waswas. Or lo garden, we respect that. But nowadays, crazy people are, emerging even in the rural areas, subjecting women going to the gardens or to going to bath or going to all go washing utensil down in the river too. They're subject to violence or threats or intimidation. It's increasing in the rural areas because structures in the rural areas are collapsing, custom collapse, system of leadership and so on are collapsing. What's the alternative? So it's making a lot of people become vulnerable, and women and girls in particular, they're becoming most vulnerable in the rural areas. Police staff to have some sense or level of comfort. Police staff, and if they rely on their relatives too, they might not be there, might be very forthcoming. So if we do a survey down in the rural areas, we might really capture the real level of violence that's taking place. And so the effort is to make, to reduce the instances of violence, make the environment conducive in the, family space, private space, in the community space, and in the district and the province. And once we do that, the nation will become a greater peaceful space so that our people can become innovative and creative and build the nation. Build the nation. Violence is impeding all of us, impeding women and girls in particular, but it's impeding the entire nation and its potential. All right, we'll go to Deputy Provincial Administrator from Yenga. Yeah? Oh, our member for Wawari, a committee member, will make some comments or ask questions. Alatau first.
We'll ask them the same questions.
Thank you, Chairman. We decided to have the Momases go in one so we can ask them the questions together. Thank you, our two deputies, for your presentation. We appreciate your participation and your work in terms of the GBV. I just want to just put some perspective and highlight where we stand in terms of the survey that was undertaken by our team. From what is before us, I think Momase region is worse in terms of violence, where 90% of our women have survived GBV. That's followed by the Highlands region at 80%, Southern region at 70%, and of course, New Guinea Islands on 62%. That's where we stand in terms of our regional numbers. My comments and remarks in terms of our provincial approach is the committee's main focus is trying to get the provinces to localize the strategy, because each province is unique in its sense. So for you to take ownership is one thing that we want to emphasize in terms of taking ownership of the strategy, your budgeting efforts, your efforts in survivor service delivery, and of course data collection. One of the things that has come out from the earlier presentations by the administrators is the database. And it has taken most of us probably 5-10 years to develop a database. And I don't see why creating a database should take this long. And so that is something that this committee will take serious note of and bring forward in terms of how we can strategize in supporting you with the database. If it's going to be used for your planning, and if that database is going to unify all the information in the province, like we heard this morning, the health have their own data. You have the police having their own data, and of course the courts. So how do we synchronize all this data into one system is the challenge before us, and of course you at the provincial level to strategize how you will come up with that one system that can capture all of this. And of course your community prevention efforts and response efforts, all unique to your strategy, so I will not comment on that. Just a question in terms of the reporting mechanisms. So after you get your reports, it comes up to the community development. Those reports do reach your PEC, of course, through your chairman's responsible in the community development, present some of those statements in the assembly. Do those reports bring some alarm to the PEC to realize that the numbers are not looking good, and what does the PEC and the governor think about these statistics? Like I realized in Morobe's presentation, PEC is yet to endorse your strategy plan. So are those reports not reaching them to give some indication that, look, this is important and we need to take action in endorsing this. That's my
Thank
question.
you.
Yeah.
Actually, we were planning for the Office of Secretariat, GBV, and the UNDP to give us the reviewed strategy so that we can document and present it to the PC, and that's the holdup. However, the report, it's an annual report that we used to compile. So the matter that and it always goes before our chairman, provincial chairman for community development, for his taking part. We have failed on our part to make sure that it reaches the provincial assembly. Thank you.
Okay, thank you. Chair, just a point on in terms of all the reports from the provinces. The question remains whether our secretariat is privy to those reports as well. I think the reporting mechanism from the provinces, local level government, to the district, to the province, and up to the secretariat, I think that reporting mechanism has to be in place so that we are up to date with our data and know the status of all of the agencies that are involved in this. So I think that's something that realize where the gaps are.
Yeah.
Thank you.
Through you, Chair, this will be the way forward for this meeting, for us to put in place a mechanism so that we can report and reach you. Thank you.
Chair, I would like to ask some questions. Thank you for your reports. As my colleague member has mentioned, Moma says high level of violence, GBV violence. So this is a concern for this committee, and we would like to drill down a bit. So if at least one province we can target, then maybe it will bring down the stats for Momase. Is the secretariat for GBV here? So can she take the chair too, so I can have some questions to ask? Chair, through you. I'm not Staba. Okay. My question, I'll drill down a bit and go and target my own province, Morobe. Okay, considering the stats that we have, for Momase, the highest level of violence is in the country is Momase. And if you drill down to the provinces, the lowest is East Vic province, so that's a bit in the region. The second lowest is Madang, Mering, and third is the first is Morobe. Morobe has the highest stats of domestic violence. GBV. And then you have the West Sibik, Meding, and East Sibik. So it's a concern when Morobe is a very big province. Sometimes we say it's a country. It's a big province. We have 10 electorates and nearly 10% of the population or so of Papua New Guinea. So it's a very geographically too also big. So if we able to control that gender-based violence in this province, then and also it also generates a big outside of NCD, it generates a big internal revenue. It's by itself. So if we able to control GBV in Morobe province, then we'll be able to bring the stats for Momase down. So my question to the deputy administrator would be in some way to be able to get some answers from Morobe. My good deputy provincial administrator, do you authorize the budget payment? The setup of the budget.
Thank you.
Provincial budget. Are you the final signature on the provincial budget?
Normally the practice, thank you, Chair. Sorry. Normally the process used to be with the sector heads used to draft the budget, and it used to go through the provincial budgetary committee and us, the senior executives, and we debate over. Unfortunately, this has gone. Morobe has gone. So, like, I have no saying in the budget. I do draft the budget, but I have no saying. I've never seen any budget. Therefore, it has been, it's one of the impediments to my social sector running. Therefore, my recommendation stands. Thank you.
Thank you for your honest response. Chair, through you, I would like to also, while summoning the governor, we will also like to summon the provincial administrator for Morobe also. So we can drill down to see, to make sure that there's a GBV funding on Morobe budget for 2026. So that's very important. Please take note. The other question, the GBV strategy, has there been one, or you are currently drafting, or has there been one and you are trying to review, or you are waiting for the secretary to send you one? Can you clarify more on that?
Thank you. It was, I came in, I'm a district administrator, I came by the province. And when I came, I took the chair from Junior Wagambi, who was the chair of the FSVU. So I took in charge, but it was worked on ad hoc. So I started because, and they were telling me that the strategic plan is already in place and it's going in for review. So I come and I write. But when I saw that it was taking too long for it to release so that we can do a submission to PC for acceptance, I thought it would be best we capture all our GBV activity in our strategic plan so that we roll out it as a normal yearly activity. Thank you.
Okay, so whose responsibility now to come up with the GBV strategy? Is it the National Secretariat or the provincial, your provincial administration?
Thank you. Now it is our responsibility. However, we have done that already, and we have submitted. But UN people came and helped us with the secretariat, so that we completed everything with a draft cash flow, everything. But they took our strategic plan here, and they said that they will formalize whatever, decide everything, and we are still waiting. They put us on pendulum to date. So I continue to follow up with our officer. Unfortunately, I've lost my officer who is in charge of that. She went on with the Australian High Com, so now it is like me and the community development. So there is no person responsible for GBV Secretariat in the province now.
But the strategy is with the National Secretariat.
Yes.
So they should release it to you guys so for you
Exactly.
to do the PC endorsement. Okay, Governor, I want to bring to your attention that Morobe GBB strategy is with the National GBB Secretariat. They have to finalize it and release it to Morobe provincial government so that they can bring it up to PC for endorsement. Am I correct in saying that?
You are correct, through your chair.
All right, thank you. Okay, that's where the GBB strategy for Morobe is, with the GBB Secretariat, National Secretariat. There's to make sure before the PC endorsement, it has to come to, it has to go to the province so that PC endorsement can happen. Can we have a time frame for this, please? Can I have a time frame? Can we say second quarter, like June or something?
Thank you, through your chair. I'm taking note of it, and I will follow up as I return tomorrow to lay.
Thank you.
Maybe make a commitment.
Yeah.
By certain time, or and by also being MP from your province is very concerned about procrastination. So I'm not present. Is very concerned about the procrastination. So we need to show seriousness and urgency. So I think best is if you can make a commitment. Follow-up is okay, but make a commitment like by this time I can report to the committee or to the secretariat by June or July or something like that. That's what he's asking you to make that commitment. So by end of the second quarter, so April is probably end of first quarter,
Yeah.
and then 3 more months or 4 more months,
3 more.
that's around July or August, make a commitment to have the strategy finalized and then brought to the PEC, endorsed. And in terms of budgeting, we are probably late for this year. So you all have to work for next year. But in terms of the strategy being with the Secretariat, there's no reason why the strategy should come to the Secretariat. It's not their property. If they're just supporting you all to maybe refine it, then it's probably that part of the contribution, but it should be your property. You should take ownership of it and drive it. And this is why I'm saying that there must be a focal point or better coordination. So what I can say too, that perhaps your governor is in some sort of a denial. And I can hear it from his debate in Parliament because he sits next to me and I know what, the narrative or dialogue going on or energy going on. So in his debate, he seems to be in some sort of a denial. So we got to present the statistics to him. The statistics of what the Secretariat, National Secretariat has come up with, our team has come up with. And you all could also do a survey within the urban areas, pre-urban areas, and the rural areas. You don't have to survey everyone, but you just get a sample. The sample doesn't go wrong, because once you get a sample, it is representative, but it will be a true reflection, indeed a true reflection of the cross-section of the community. So then we can present that to him, because GPP, many times you don't see it. It is some physically visible, like if they have been cut or beaten up, black eyes or sore face or something, you can see it, broken up limbs, or it can be seen. Or if there's some vicious attack, it can be seen. But some of them are also subtle or psychological or intimidation and so on that goes on. These are still, violence, however it is, because it amounts to, interfering with the liberty of a person, their rights, and their freedom to be able to live their lives. So all forms of violence we are trying to, identify so that we are creating an environment that is peaceful for everyone, especially for women and girls. Men, violence, they become used or numb to violence and they just go on with their lives. That's good, but also it's bad too, because when we men become numb to violence, then we don't recognize the pain and suffering that other sectors of the community, especially women and girls, carry, and looks at us and that's violence. And then we allow it, or we give permission for it to get worse and worse. And who suffers? Not just women and girls, but the country as a whole suffers. So we try to work on the strategy for our part. Absolutely, next inquiry, we will summon your governor and the provincial administrator in Morobe. But also, between now and then, let's have a dialogue with him. And I'm ready to have a dialogue with him and even a debate with him. So even we are in law school together, and he still think we are in law school, and he always debate, and he hasn't changed. So I'm ready to have a debate with him too.
Thank you.
Chairman, please, I have two more.
Yes,
questions.
yes.
Okay, so we have a commitment for July to be the date for the GBB strategy for Morobe.
Chair, it will be June.
June,
I've
okay.
made up my commitment.
Okay, thank you.
I'll follow up and get it.
All right, thank you. Okay, one more. From your report, I know that we only have one safe house in Morobe. Am I right?
No, we have four.
4 safe houses, okay.
Four safe houses.
All right, okay. I was not hearing correctly, so it's a big point, so we should have like,
Chair, through you, however, the city missions provide, it's a private entity. So now what they're doing is they're charging per night for our survivor. So we have several tsunami, but the servers is going on maintenance. So STA has come up with one, so we have almost 3 now at very moment operating.
okay. All right, thank you. Last one, I think that is a comment. The Secretariat is not here, but to take note, all the provinces who approach this inquiry have mentioned that they need a database. Nearly all the provinces that approach this inquiry has made that they need a database. So I think it is up to the National GBV Secretariat to come up with just one database that can be accessed by all provinces so to report those GBV cases. So, Chairman, through you, the Secretariat to take note and they just do a one budget so that that covers all the provinces so they can have a reporting tool or mechanism in place instead of they coming up with their own database. So we have a central database for all provinces to report their GBV cases. Thank you, Chairman.
All right, thank you. We'll move to the Deputy Provincial Administrator from Enga Province. Or, yes, from Enga? Yes. Thank you.
Good afternoon, Chair, and members of the committee. Good afternoon. My name is Henry Kapau. I am the Deputy Provincial Administrator responsible for social sector in the province. I started this work 3 weeks ago. So in a way, I got my appointment 3 weeks and I'm happy to attend this session.
Thank you.
Because I also learned from research that I've conducted before coming here that there's a PEC decision that has appointed a Deputy Provincial Administrator of Social Services to be the chair of committee on gender violence, gender-based violence. So this is giving me an opportunity in this hearing to learn a lot of what is required of in the provinces so that after grasping all this information, I can go back and actively provide leadership in ensuring that these issues are attended to. In the absence of my director, community development, who has been sick for almost 1 month, 2 weeks, and also where the province is going under appointments of public servants. The senior appointments have been done, but the lower appointments are still in progress. Been delaying. We have a community development, a skeleton community development office now, that before I came to this meeting, I was not able to be assisted to prepare anything in to present to this session. And there hasn't been a PowerPoint presentation, but having been informed on the last minute, and like I said, into the job for 3 weeks, almost 3 weeks into 1 month, I was able to understand from asking around and researching within the government agencies in terms of how the gender-based violence have been attended to. So I have a little presentation here verbally, but when I return I'm able to get my officers and get all the information together to do a proper presentation and send it to the Secretariat for record purposes, which I will do. Committee members, through the assistance of donor agencies and development partners, the Enga Province GBB Prevention and Response Strategy Plan 2023 to 2026 has been produced, and the plan is in the third year of implementation. The Enga Provincial Executive Council has approved the establishment of the Provincial Family Sexual Violence Action Committee in 2021 through a PAC resolution. This committee now also oversights and addresses GBV and related issues such as sorcery accused related victims. So there isn't a separate committee established, but the previous committee that has been established to deal with PSVAC in 2021 is now oversighting gender-based violence issues in the province. Since the establishment of the Provincial Family Sexual Violence Action Committee, the Enga provincial government has been allocating 120,000 every year to roll out the program according to the budget. And with the establishment of Enga Provincial GBV Strategy 2023 to 2026 plan, a budgetary allocation of 70,000 for this specific activity has been allocated. Those are information I got it from PEC resolutions. The implementation of the gender-based violence strategy has been challenging for various reasons. One most peculiar one is focal point strategy officer has not been recruited, or a space has not been created to facilitate and attend to the implementation of gender violence-based activities. But having learned that, I've done a submission to the HRM to appoint someone who is specialist in that area on a casual contract, so that someone can be full-time working in that office to facilitate and not only that officer, but I also saw the need for other officers in the other divisions that I'm responsible. So I've sent in a request for casual contract officers to be appointed, which can be captured in the HRM budget. So positive response has been given. And when I go back in the next hearing, I should present the work of that officer, which will take on the leadership to facilitate activities to do with GBV. So the gender-based violence awareness and safe house establishment and coordination of prevention and the response strategies are implemented by mainland churches. Mainland church activity groups such as the Caritas, the Catholic, that is very strong in Enga. And there is also another response unit organized by the Lutheran Church, where they have aggressively attended to sorcery-related violence. And those are the two agencies in the church that has helped to facilitate and attend to those violence issues. And I also understand that the funding that the provincial government has allocated is parked in the community and development recurrent budget. And the community and development director who is sick has used the community-based organizations, the churches, to do awareness and roll out this program, which I will go back and find out. Like I said, I'm new to the job, but it's good that I'm having this audience to attend what is required of in the province. And as I try to get the data together to present a report to the Secretariat, I will be interested to know what activities have been conducted and report within the next 2 weeks to the Secretariat. Okay, as you all are aware, the trouble fight has become nasty in recent past, and there are many gender-based violence which is camouflaged by the big trouble fight, unreported. So that is one of the challenges in the province. Sometimes gender-based violence slipped away without being unnoticed because of this big trouble fight, which the focus by police and the community is on the trouble fight. And as that has been affecting the province for the last 2 years, the data collection to understand gender-based violence have not been so helpful in that respect. So, and also, if there's been some data collected and some activities conducted, I'm yet to find out when my officers and when I mobilize those people together as I prepare the report to present it to the Secretariat. Despite these challenges, church groups, non-government organizations, and community leaders have addressed gender-based violence and social issues on ad hoc basis and one-on-one basis as they become occurring in the communities. Way forward, I plan to organize regular meetings, and under the PEC resolution, which has tasked me to facilitate meetings so that I'll ensure all the partners and stakeholders are involved in trying to address prevention and respond activities of gender-based violence. With that, thank you, and in the next hearing, I should be well prepared to address. But situation has been such that here you can see that I've been asked to come to this meeting, and that's how I've come. But I've tried my best to collect data to establish this verbal report that I'm presenting now. Thank you, Chair.
All right, Deputy Provincial Administrator Enga, we appreciate your predicament and thank you for coming to the inquiry at this time to update our committee and have this dialogue. And we take note of the work that has taken place. Some commitment has been made by the provincial government. Maybe budget has been allocated. But I think the reality seems to be that not much has taken place of progress, and commitment is not as strong as it should be. So I think while we appreciate your attendance and report, I think my committee and they all can speak on their own too, but on my part I would express a bit of disappointment given the dynamics in your province and the agency to respond. There are high instances of tribal fighting, and of course in the tribal fighting situation, women and girls becomes victims. They are subject to harassment, kidnapping, rape, in that type of environment. It's not just unique to Enga. In all areas of where conflict take place, civil wars take place, tribal conflict takes place. There's a breakdown of systems, and the most vulnerable becomes victims. In situation of war, like in civil war now in Sudan, I think there are high instances of gender-based violence. Women and girls are victims. In the Congo, women and girls is all documented by the United Nations. In the 10-year civil war, whatever we describe it, crisis, or in Bougainville, there are a high level of gender-based violence. Women and girls becomes victims. Kidnapping, rape, and all instances of such incidents happen. So I think on our part, we are a bit disappointed in that respect, and please communicate this to your provincial administrator. The fact that you are just a recent appointment, 3 weeks, we noted that, but if the program was had given priority and was being rolled out, you all working in the provincial government, whether you were working before in the district or in the provincial headquarters, it will be visible and you will all know it. And the fact that you're not familiar with it or what is happening shows that it's not being given high priority. So I want to, on behalf of the committee, express our disappointment in that respect. I think the other point I want to raise, and this was raised to us in Mount Again. I was part of the listening tour that the Secretariat and our review team are reviewing the strategy so we can formulate the new strategy, because the current strategy ends this year. In Mount Again, some of the frontline team in Enga, they came to report, and I think also from the provincial government. So one of their complaints was that, yes, the provincial government allocated money, but did not remit it or was not used. On paper, it's there, but in reality, it did not come out. Maybe not all the years, but some of the years, the money was not actually, what's the word? Remitted or released, so that it can be used by, if there's no coordinating center, at least the stakeholders like the churches or CSO, or they did not actually see that money. So the commitment is there, but it might be in theory. In theory means provincial government allocate money, but it's not released to the sector or to the focal point or to the secretariat, maybe because the secretariat does not exist. And so I want to also impress on you too in terms of what we have, the dialogue we have with the Morobe and Isipik, that we prefer that it be focused and coordinated on its own. Of course, it can interact with all the other sectors in terms of responding to social issues and challenges, but it must have its own focal point. Then we give it attention and we are tracking it. We see how much resources have been allocated, what steps and what the strategies are, how we are implementing the strategy, monitoring the effect of the strategy, and getting data, and we are comparing data to see if there is a difference taking place. Prevalence is coming down. So this is the benefit of coordination. So I want to just leave those comments with you. If our deputy chair has some comments and committee members have some comments, I will invite you all. Otherwise, we will excuse the 3 provinces that are here.
I don't have any major comments except to say that it would be beneficial, I think, that in future we perhaps have a shorter reporting format. I think we accept now that everyone has adopted a strategy, so it would be nice to start measuring progress. So perhaps when everyone comes next year, we'll just have a standard reporting template, and you can report successes and challenges, and we can figure out ways forward. And And I think that will get us, if we spend enough time developing strategies and so on and so forth, it's time to start reporting on results. Those are my only comments. But I think all the provinces have done pretty well. One of the things is that even if you don't have a strategy and you're already doing things, I think that's something that we should applaud. But again, coming back to my initial point, we need to show that we are achieving some results.
Yeah.
Thank you.
I think generally too, I would like to say this too, that they are, in terms of the CSO and faith-based organization, they are very committed people working in the front line. They are committed and motivated more by their passion, and some of them, they come face to face with, violence. They probably are victims or survivors of violence too, so they are really doing good work. And these frontline people, they need support. But where will the support come from? It has to come from us as a national government and also provincial government. So national government, you can see that it's slow.
Yeah.
It is very slow. The strategy was launched in 2016, but between 2016 to 2022, there's no funding, no appointment of a permanent executive director. We had an interim secretariat and interim people were all acting. So it's not a good testimony for us. Nationally, we are not tracking very well. So now on our part, we are trying to energize us at the provincial level. If at the national level we are slow, but at the provincial level we are energized, then it can make a difference because the people are in the provinces, in the district. The problems we face come face to face in the provinces and in the district. At the national level is just overarching coordination, making resources available, policy, building capacity, but it's at the provinces and the district that will make a difference. And if the provinces are energized and undergo and, really having a impactful, strategies that are going on, then once the provinces are changing, the nation is already in alignment. We're getting there. So we don't have to wait for the provincial national government. On our part, we are pushing the national government, and it's because we set up the coalition initially. Myself and Deputy Chair, we started the Parliamentary coalition, which was not a official government initiative. That Parliamentary coalition made up of volunteers in Parliament, all of us recognizing the seriousness of the situation in our country, and then we push for the creation of the Special Parliamentary Committee. And the work of the Special Parliamentary Committee resulted in the funding starting to come in. And it's still a, very excruciating exercise to get the money from Treasury to Finance to come to the department, and then from the department to the Secretariat. It's still a big problem. It's painful. That's why I say it's excruciating, and we don't need to do this. That leadership at the national level and the provincial level must recognize and make the funding available and respond as to match the crisis that we have. It's a pandemic. It's affecting a lot of our people, but we are just, as I said, operating and responding in a casual way. So I'm just emphasizing this point, not just necessarily to you all three here, provinces. I thank you all on behalf of the committee for the work that you have done, but you must triple, quadruple up, upscale. All right, thank you, gentlemen. Thank you.
Final comment.
Yes.
Just on the provinces, I think of all the 22 provinces in this country, only 8 responded and were part of the inquiry today. And I think, Chair, through you, it's important that all the provinces must attend this inquiry and present a report and give a status update of this. So if we can have another inquiry of some sort and someone or invite them again to come and give the update, that would be good. So I'm just bringing it up because it's as you rightfully mentioned, it's the provinces and the people are in the districts and the province, and they are being affected, not at the national level. So we want to see real commitment from the provinces. So for those not present today in this inquiry, I think we should have another inquiry again and make sure that they should come. And to show respect to this committee chair, through you, we need the administrator, provincial administrator, not acting, not deputy, just provincial administrator to be present. They are the Section 32 officers of the province. They make the budget. They sit with the governor. So they should come to this inquiry and give us the update of what is happening at the province. Chair, that's a concern from the committee member. I think that's not only my concern, but also my other colleagues' concern also. We need to have another inquiry where all the provincial administrators must be present in this inquiry. Thank you, Chair.
Thank you.
Yes. Chair, respectfully, I respect the comments from our good member, the Honorable Narawek. I just want to say that in Isipik, I have good people, and Mr. Kami, who you see here, is very capable of, in fact, he drives the agenda for the GBV, including our lady rep here. They drive the whole agenda, and they have been for a while. And not only that, in Isipik, we do things differently. The budget is actually constructed by them and the presidents, not by the governor. So I just wanted to make that clear that Miblalo Sipik, if you see Mr. Kami coming, man in charge logoke come sit down here. So and for me personally, and I think for the province, we have confidence in him, in the work that he is doing, and that's why he's doing it. It's awesome. With due respect to everyone else, I just wanted to know Mr. Kami by feel no good because if the administrator was here, he would actually bring Kami to do the presentation. Because one thing I encourage my public servants to do is to delegate work and to make the deputies responsible. That's why I think we are the only province with 4 deputy administrators. Am I correct? Engatu igata. Morobe too. So not many provinces have 4 deputy administrators. And there's a reason for that. And Mr. Kami is, in fact, Isipik is going to go for a 5th deputy now because we need an international one based on our relationship with China. So we will be applying for a 5th deputy administrator. So me talk salo ibla no can down him all point blow let all public services from me. Thank you, Chair.
Thank you, Deputy and Governor Isipik, and also Member Wow Warrior. I'll take note of it. I think this inquiry, we decided to just send an invitation, friendly invitation, because we have not met for 1 year, and we are trying to get, our, committee into action again. So I decided that we send a friendly request. But of course, as I mentioned yesterday, that we absolutely have the power to summons. It's a parliamentary power that we have, and we can resort to that if situation warrants. And I think we are almost reaching that situation where some governors are dragging their feet and provincial administrators are dragging their feet. So whatever. But so we might be compelled. So we think about this in the next inquiry, which might be called around the middle of the year. But let's take note of that. We don't have to go to that extent. The provinces, please impress on your provincial administrators, and on my part too, I keep having dialogue with all the governors all the time. So the invitation that came to you all in your capacity as provincial administrators and deputy administrators were all sent to the governors as well. We all have governors chat page, so I normally have dialogue with them on a governors chat page, but also I dialogue with them on one-on-one, except Deputy Administrator Morobe. Your governor is not on WhatsApp, so it's a unique governor of his own. So I will deal with him, in that context. So we might have to summon him. Yes. So, yeah. So with those comments, I thank you all once again. Thank you for coming to update us on the work that you are doing, and please take the message that we are conveying to you all. Parliament has spoken very loud and clear last week that we must take action, and that's what we all need to do. Thank you once again, and please, you ask this. I want to take note too, in this respect too, that our city manager was here yesterday, but today he went to replace me because my deputy is flying today to Hong Kong. So, yeah. So.
High flying deputy.
City manager is not here, but we will have our report from the city, especially given me and our member for Northwest are here, that we have a report and it shall be submitted to our committee, so it will form part of our hearing now. As you all can see on the schedule. I think this morning I saw our manager in the Family and Gender Division was here, but we probably did not give you an opportunity. She's here. Oh, Daniel is still here. Do you have a report? You can just submit. No need to speak. No, we have to go through the CSO. So if you have a report, you can just send it in and we'll just take note of it. Yeah. And our Deputy City Manager too, Community and Social Services, Ms. Haus is here too. So our team is here. Sorry, my apologies for not recognizing that you are here. Please, Ms. Winifred, please just, Ms. Haus, you can just end in our report. No need to present. Yeah. All right. Okay, with that, we will go to the last part of our inquiry, and that is for the civil society representative. Are they present? Or? Okay, please come and take the podium. I think you all have selected a number of leaders in the civil society to speak on your behalf, and if you can come and take your place here, then we can hear you all and complete our hearing for these 2 days. Thank you, ladies, Ms. Waineti, Ms. Kisam, Ms. Kaupa, thank you, and your other colleague. I'm not too familiar with the two others. Ms. Mandu.
Daniel.
Yes, thank you. Thank you for your attendance to represent the civil society organization. Please For the record, you'll all introduce yourself, and then we can have the dialogue and exchange. Perhaps on behalf of the committee too, before you all go on, pardon me, I just want to put on record our deepest appreciation for all your work, working in the front line so many years. Ms. Waneti, working with the Family Sexual Violence Action Committee 20 years plus. I want to acknowledge and give you credit for all the work that you have done and your committee have done, bringing us to 2026. And then we, through the Department for Community Development Minister, then Honorable Delilah Gore, putting together the strategy. We launched it in 2017, and it's continuation of the work, that wonderful work that you all have done. So a lot of work has been done, great work has been done. We have to acknowledge that. But the sad reality that remains before us is that the statistics still going high. So this is the somber reality that we are faced with. So does not take away all the hard work that you all have done and continue to do. But it challenges all of us. What more we can do, how we can do things better, so that we are making a difference, a real tangible difference. I think that's the main conversation we can have, apart from every other points that you all want to say. So please, I'll leave it to you all. I think you all have worked out who will speak first. But if you all have not worked it out, maybe we will go with Ms. Waneti and then go this way and that way. Yes. Yes.
Thank you, Governor. I remember dancing in 2016 when you helped us to push the GBV strategy through. We were all dancing, thinking that all our problems are solved. And now we have reality of the statistics still going up. And I want to acknowledge what you and Governor for ECPIC are doing with the other committee members, speaking on our behalf. We have sort of become voiceless, and knowing that you people are speaking on our behalf give us courage. We don't have really presentations, but we'll comment on some of the things the politicians and administrators were talking about. One thing that was touched was the referral pathway. I'd like to say that referral pathway, when we created referral pathway, it was because we were told by government, and this government program, this is not civil society is running with it. We came with problems to tell government that these are the issues we see, and government agencies responded. And so that's how we had the referral pathway created. Because when I walked into POMGEN, late Dr. Babona said to me, I cannot give you a doctor, but anybody who walks through the accident emergency will be treated here. And so that's how the referral pathway came about. We couldn't have a one-stop place. And so FSC was established, family sexual violence units were created, safe houses with NGOs were established, and we also had a public prosecutor's office who you didn't call here to tell us what they're doing, and public solicitor's office, because they also deal under national court volunteers who are not called to also report back here. Magistrates do. What I want to say to you is that the referral pathway is good, but it lacks people with skills to serve. We don't see disabled people go for services because we can't communicate with them. We don't have people with skills to talk to the deaf and the dumb. So that's one big stumbling block. We don't have FSCs, FSVUs, where wheelchairs can go up. So those are stumbling blocks to people seeking services. And we know that many times women who are in the wards who are disabled are the ones who are raped. There are no internal referral systems established in the hospital, in the police, and wherever. So we have that outside imaginary referral pathway, but we don't have actual protocols developed in the agencies for referrals. So anybody who comes through with trauma, like arm has been cut off, or ear has been removed, or lip cut off, she is not referred to the FSC to be followed up in the ward. So those type of referral protocols are not in the police and the health department. Though I know health department has done a lot, but it's still not enough. So that's one thing. And also, we think that the committee should look at what skills are being now taught for social workers and others to provide services there. How do you train a social worker to work in the FSVU? What trainings do you give for that person to work in the FSC? What skills do you give them to work at the safe house? So there's big gray area in when it comes to skills. We are bringing gender advisors from other countries to advise us. We are not training gender advisors in country so that we look at gender from our own perspective. Counseling. Everybody talked about counseling. We are struggling to serve. Thank you very much. We received 3,500, the PNG Counselors Association, from government. And it made us move to provinces because our aim is to have at least 25 to 30 counselors in every province with basic counseling skills. And so far we have reached 8 provinces with the money that was given to us and with donor support. But there's still a lot more to do. One other thing that was also raised was, I had you and the deputy chair asking the department, how do you make awareness? FSVAC created a lot of awareness materials that are still with CIMC. Is it possible to get them from them and print them out under the new GBV Secretariat logo and send them out to provinces for awareness? We also have national trainers in the provinces. You don't have to send trainers from national level to go to do trainings. Provinces have their own trainers who can do awareness on GBV. And provincial FSVAC, provincial referral pathways are there, but the GBV secretariats are the coordinating body. Without them calling regular meetings, the referral pathways will not work. Because we come and meet together and hear each other's what we are saying, and we support each other's. And the nation, the provinces, is also a referral pathway. If you're moving a person from Sepik to Morobe, you get in touch with the Morobe partners to receive the person being moved from WIWEC. And that has happened before, and we need to make sure that provinces know each other. So I was glad to see provincial administrators here, but it would be good to also bring actual practitioners to be here so that they dialogue and they establish those relationships. Because I know that when we establish those relationships, you contact your friend in the other province, they'll immediately act to help you to move the survivor. Yeah, I'll leave it there and let the others talk.
Thank you, Ms. Wainiti. Ms. Kaupa.
The right to life, freedom, personal safety, and legal protection are basic human rights. And the state has the utmost responsibility to ensure that those rights are provided. Good afternoon, Chair, Deputy, and the members of the Permanent Parliamentary Committee on GEWE. I actually extend my heartfelt gratitude for providing this strong platform that empowers, protects, and advances the women and girls' agenda and rights in PNG. Thank you, Thomas. My name is Gabriel Shirley Cooper. I'm the founder of Magna Carta PNG and the co-founder of St. John of Arc, Safe House. The other founder is Ruth Kisem over there. I am here to represent the crucial role of civil society in providing feedback on the state insights and sharing recommendations for gender equality and women's empowerment in PNG. Firstly, I acknowledge the strong force out there in the remote, rural, and communities where there is a lone catalyst for GEWE, and those front lines who make it happen without the presence of police, rule of law, courts, health services. They remain our heroes, and if they're hearing and seeing on their Facebook or social media, I thank them for their efforts. To our outworking officers from the Department of ComDev, DJAC, police, health, courts, law, justice sector, CSOs, FBOs, CBOs, community leaders, peace and good order, community health workers, village court magistrates, community-based helper, community health volunteers, village midwiferys, village skill trainers, teachers that is teaching girls in the church or under a tree. You are still a part of this advancing women's rights in the country. And what you do out there that is not recognized, I actually thank you in front of the committee here. This effort to advance women's and girls' rights in the country, it's a collaborative effort, and it requires each and every one of us from all levels of engagement and intervention. Thank you to those who work in the disability space, HIV, PRISM, and many other critical areas. I acknowledge your effort in front of the committees. You all play a crucial role. Without you all, the agenda about advancing women's rights in the country will be a strong, robust issue that we will still struggle. But because of your support, we at some stages achieve some results. Chair, deputy chair, and the committee, we have a robust, broken system. And as much as possible, we are working 4 times harder to make it happen for our women and girls, especially in the protection space. Empowering women and girls in Papua New Guinea is a complex challenge, but it is essential to recognize the significant progress that has been made. And also taking note that PNG has ratified 6 of the 9 UN conventions addressing various aspects of human rights, and that is including the Convention on the Elimination of All Forms of Discrimination Against Women, which later Ruth will talk. However, the path to achieving gender equality is not straightforward. We must acknowledge the significant challenges of cultural norms, socioeconomic disparities, and systematic discrimination. Despite the country's commitment to achieving gender equality, significant barriers still exist. These going struggles affect women and girls on a daily basis, and it must understand and address them. We, as frontliners, policymakers, legislators, leaders of the parliament, must understand and address them where we can. Societal attitudes towards gender roles often limit women's opportunities in education, employment, and decision-making processes. Additionally, issues such as violence against women and inadequate access to healthcare services in the progress for health and safety and well-being of a woman. And when a woman is affected, the family, the children, and it goes down the line. And the home will be broken, and that's the aftermath. To overcome these obstacles, we must always engage in comprehensive efforts to promote women's rights and create a supportive environment for our girls to thrive. All societies, including Papua New Guinea, need our women's full contribution and talent, and rely on our women to healthy and safe. And we all create a safe society for the future of the women, our girls of today. Only through sustained collaboration and advocacy, with the active involvement of all stakeholders, can PNG move closer to achieving true gender equality. All our involvement is crucial in this journey. And now, the Honorable Committee, I like to share my feedback and recommendation, and also presenting some data for the work Magna Carta is doing in terms of responding to girls and women's issues. Some achievement for Magna Carta in 2024. Our safe house, St. John of Arc, actually provides service to 238 survivors, which 121 are children and 117 are women. And also last year was for the first time that we actually put in a 16-year-old boy because the boy cannot be out somewhere and there's no place for boys who follow their sisters or their mothers. So for the safeguarding and for the protection of the boy, we actually put the sister and the brother together. Magna Carta has delivered 3 days of human rights sensitizing training and child protection, safeguarding, access to services to 5 different duty bearers. Magna Carta also conducted 2 days of victim impact statement writing for 24 safe houses or safe house workers in Port Moresby so that they can support the police FSVU. Magna Carta also conducted female and juvenile jail assessment in 8 jails in the country last year, and that was supported by the UKI Commission and PNG. Magna Carta have engaged with over 150 juvenile inmates and 200 female inmates in the jail. That's for their skills building and training, supported by Digital Foundation. Our volunteers, our legal volunteers or pro bono lawyers filed 8 IPOs and drafted 22 legal documents and provided counsel and guidance to over 96 survivors last year. And we continue to work in the space of improving, promoting and protecting human rights. That's the data that we want to share. And I'll just quickly provide insights or feedbacks to the presentation made by the state critical partners yesterday. For the DFCDR, for the policies of GEWE, GEWE strategy, CDO and WPS, there is a challenge here is the National Action Plan. We have to have the National Action Plan that actually interprets, communicate, and help CSO and partners to implement programs and policies into program and program into project and activities that it can be seen, the visibility of all these strategies, policies, and whatever. That's one. And the other thing is the leadership and coordination between the GEWE policy, the National GVV strategy, and the GESI policy. How do they come together to coordinate? And the recommendation is communication of the annual plan should be presented, and also it should be interpreted in a way that CSOs can design their activities to achieve, in a way that there is a national coordination for all these national documents. And one more issue, key issue now is to improving approach to disaster and humanitarian approach to cater for the vulnerable women and girls. And there is a need to improve on that. That's for the DFCDR. And for the DGEC, I thank the DGEC for the establishment of the Human Rights Secretariat and the work towards achieving the National Human Rights Institute or Human Rights Commission. And I believe that it will empower a lot of issues about human rights, but specifically for women and children, it's a very big protection mechanism for us. The issue here is the coordination and implementation of Family Protection Act. And one of the main things is access to justice, and we start from legal protection. How do we empower Family Protection Act that interim protection order or issues of interim protection order given in a timely manner. So in a way, protection can be given like, let's say 72 hours. The survivor should already been given an IPO. And that's bring the question of who is writing the IPO, who is drafting, and who is doing the filing when you have limited number of pubs sold and you don't have legal aid support for the women victims and survivors. The other issue is increase of child sexual abuse and sexual exploitation and abuse, and that is connected to trafficking in person, bringing girls out, tricking them and bringing them for this sexual exploitation. And my question is, the current status of National Anti-Trafficking Committee, where are they? And also the anti-trafficking NAP, what is the status of that as well? And to the police, the first challenging issue that we have is the operating hours of the police, FSVU. So it operates on 9 to 3, and it has its own program on different days of the week. And a lot of issues are happening after hours and on weekends. So my recommendation would be if the police department can cater or make roster for an FSV officer to be on standby at the general duties after hours and on weekend. So that makes it easy for referrals. So women and children are not sleeping outside of the police station at nights, but they're given accommodation and safety when and where they need. And the next is the subject matter expert. The police also need and require various skills in terms of investigation, legal documentation, and the case of Imelda Tupi from Southern Islands should be a lesson learned for us in the criminal justice system where we went wrong because the case was thrown out by the courts at Mount Again, the doctor that murdered the wife. So the recommendation should be for refreshers and skills on subject matter experts, and also train reservists to be supporting FSVU to make work easy and efficient so that effective services can be delivered to the survivors and victims. And to the health department, I congratulate them and well done on a lot of things they do. And their data, the village midwiferys, village health volunteers, they're doing a lot of great things to support women agenda in terms of health is concerned. And one issue that I see here is services to GVV survivors after hours and on weekends. How do we take care of them? Is there a possible way to attend to survivors after hours and on weekends when the FSCs are closed? So the victims and survivors don't stand at a long queue at outpatient and emergency. If there is a way that when they come in, how do without taking time and waiting, a lot of them, they are scared of the perpetrator should walk in. And we have a lot of experience on that. So the recommendation for a special consideration for high-risk GVV patient with reduced waiting at some point, if the services can be free or half price. Yeah, I think. And finally, the courts. For the courts, the turnaround time for the issuance of IPO, it's one very, very strong need and challenge we are still facing. And how can the courts improve a system that is working effectively for high risk of survivors? And Yeah, I think that's all from me. Thank you everyone, and thank you to those one CSOs that are here and to our development partners. Let's continue to work together and improve where we could or we can at all levels. Challenging times need strong, resilient people at a higher level all the way to the catalyst at the ground level. Thank you, Naimtasa.
Thank you, Ms. Kapa. I think that's a very comprehensive and valuable contribution. I was just wondering, how much engagement do all of you have? Obviously, we are the committee, so we're kind of, but at the, I guess, the operational level, how much engagement do you have with all of these state agencies that we've brought in yesterday particularly? And how often do you engage with them? Can I ask that question?
For myself, because we run a safe house for the police and the courts are the part of our partners every day. And
all right, but not so much operationally, but further up, say at a strategic level, like all the things you've suggested now, I thought were extremely useful. So I'm just wondering about how we can weave that into, I guess, the construct. And yeah, so it's going to be, obviously our team is going to be taking notes as part of the report. But I'm just wondering how, like, is there a formal mechanism that meets maybe quarterly or whatever that all of you are a part of that? You see, I'm hearing it and I like it. But I'm not the person that's going to actually make it work. I'm going to, Chairman and the team here, we're going to take a recommendation and maybe beat someone's head with a stick to try to get it happening. So I'm just wondering that, is there a mechanism where all of you kind of engage with, say, several times a year at a, I guess, at a management level?
Okay. What used to happen was, like I said, we had a national committee that made up of government, private sector, civil society.
We don't have that anymore?
No. What we now have is the national body now, GBV Secretariat has created, but the actual practitioners are not in that committee. So what CMC suggested was that they created that FSVAC committee again, and we have to work out a way where the GBV Secretariat can sit in as ex officio and hear what the practitioners are saying.
Do you see value in a mechanism like that?
Yeah, I see value in it.
All of you?
It's been adding value for so many years before this, before the merge or the break happened.
Okay.
So it's called the FSC Technical or Action Committee.
FSVAC, Technical
Okay.
Working Committee.
Yeah, so that used to be the vehicle in which everyone sort of came together and talked about this.
Okay.
But now that the GBV Secretariat, it's on its own, it's actually taken the powers, but then I think the responsibility still is with CIMC. I think I'm not really sure whether it's a policy thing. The last time we had a meeting, we went in and unanimously they said, you might as well add up the chair. So I'm the chair of a body that hardly anyone turns up. It's only the civil society that does. So we had our first meeting, and in that first meeting we were able to see that we don't have the power to actually call anyone in. They can come if they want to. If they don't want to, then they don't have to come. So then it makes it a bit odd. But if it comes from the parliamentary committee, then it might probably add a different angle to it.
If I may, this is why I'm asking the question, because as she is talking, I suddenly realized that these are the gaps that we've been spotting in all of the contributions from our government agencies, and suddenly you've picked it up because you people you're on the cold face. You are the ones that are dealing with this every day. And so it dawned on me that there needs to be a mechanism. And you're saying we used to have one, and we currently don't have one. So, because I don't think things like this should be coming to the committee. But since it's coming to the committee, then obviously something is not catching it further down. So I think that should be part of your recommendations, yeah? Because at the committee level, I mean, I'm happy to say, set it up and change whatever, and I'm sure Chairman is probably listening. He can make his own comments, but that was the gap I saw. And Shirley, thank you very much. I appreciate your contributions. Chairman.
Yeah, thank you, Deputy Chair, and thank you, Shelley. I think in respect of this particular issue, I think at the provincial level, they are trying to set up the secretariat, and so the stakeholders, including CSOs, they can, interface and have a dialogue and working relationship with state agencies and the CSOs and faith-based organizations. The gap now is at the national level. So I think some of the way forward, in the interim, there is a committee, advisory committee, which we have to have an interaction with the executive director of the secretariat and a team, so we find out what the secretariat, what this advisory committee is comprised of, and what will be their terms of reference, and who are comprise this particular committee. Another way forward is we've got the proposed act, so I've been trying to put our recommendation together. We could have a look at the act. If we take cue from the template that was used in responding to HIV and AIDS, they had a separate legislation. They work in an autonomous way, but through the Prime Minister and the Minister for Health, and they have a parliamentary committee having oversight. So we can emulate that. So if we emulate that, the options are we retain the advisory committee, which will be an interaction comprised of all the major stakeholders at the national level plus civil society, or we can call it, as in the HIV and AIDS response, it was called a council. So there was a National AIDS Council. So we could have a National GVV Council or something like that. The term or we could come up with it more appropriately later, but just thinking aloud at this time. So is this something you all can see can work for us? If it's an advisory committee, that is like we might have like at best three meetings in a year, but we need an oversight committee or council at the national level to work with the secretariat. So you all work on the regular basis, having oversight, maybe quarterly basis or monthly basis, or we have interaction, so everybody's working together. There's coordination and interfacing with all the ideas and recommendations at the national level and going down to the provincial level. So this is something, this idea we could all put together, but there's a draft law. Have you all had a look at the draft proposed act? Okay, we will give you all a copy after this, so you all can have a look at it, and
the other
can try
thing
to shape it.
you can suggest, you can look at is making sure your provincial secretariats and the networks are working and they can feed the national secretariat with the information. So if you really make the referral pathway meet every month, and whatever they're reporting there is put together by the GBV secretary